And after a quick interview, we move on to the presentation itself.
Okay, perfect.
So Corey, are you ready to rock and roll? We're going to get started with your video.
I'm ready, ma'am.
I know, and then I'm going to ask you a few questions after that, okay?
Sure.
The planted questions. I'm ready. And Nathan, thank you for joining, and I'll just introduce you, who will then introduce our speakers for the session.
Okay, sounds good.
After we have our sponsor showcase. So, Michelle, you ready for the next part of the session? Welcome back, everyone. We're getting started with another sponsor showcase, and this one is going to be with Accolade. And we're just delighted to have their support for this event. And wow, look at those colors. I think I'm going crazy looking at it. Anyway, so thank you. We'll get started with the second session in just a moment, why healthcare costs won't decrease in 2021. And but first, let's have a word from our sponsor.
Healthcare in the United States is broken. We spend more per capita on healthcare by a wide margin than any other country, and yet our outcomes continue to lag. We use euphemisms like misaligned incentives in some way to explain the idea that an industry can make massive profits while consumers suffer from very poor outcomes. Enter Accolade. Accolade was founded in 2007 to address the U.S. healthcare system's challenges by giving consumers something simple, one place to go to understand and manage all of their issues related to healthcare and workplace benefits. We're a mission-driven company filled with mission-driven people. From our health assistants and our nurses to our data scientists and our salespeople, we exist to empower people through expertise, through empathy, and through technology to make the best possible decisions about their health and well-being. We believe in doing the right thing by the consumer every single time.
Very good. Okay, Corey. Corey Simpson is the Senior Manager of Business Development with Accolade. And I just would like to ask you a few questions about Accolade that maybe you can shed some light on for me and for all of the participants in today's session. So with so much of our focus on how COVID-19 may ultimately impact care and healthcare costs, how is Accolade uniquely focused to help employers balance getting employees the care they need while balancing their budgets?
Marianne, it's great to see you. Unfortunately, it's remotely, right? But thank you for having me. I appreciate it. For anyone who's not familiar with Accolade, we provide personalized health and benefits navigation, advocacy, and clinical support. And our goal in doing that is to help every individual to live their healthiest life. Our frontline care team becomes a single place for employees and their families to turn for health and benefits questions and concerns, which increases their engagement in your benefit programs, connects them to high quality providers and care. By empowering individuals to make better decisions about their health, we ultimately lower the complexity of healthcare and costs for both the health plan and for the individual, while consistently delivering 90+% customer satisfaction. Three key things about that. We engage early and often. We cast a wide net across an employer's entire population. Our goal is for each individual to engage with their health assistant, and by building that rapport and long before a serious health event, we're in the right place to be their trusted advisor and to influence their care decisions when that need arises along their healthcare journey. Secondly is comprehensive clinical support. Our nurses and clinicians provide personalized, evidence-based clinical support at all stages of the healthcare journey. So whether a member needs help handling an acute issue or support in managing a longer-term chronic condition, we're there. And finally, better patient provider decisions. So with our insights about each member's health in the context of their full life, that whole person, our health assistants and clinicians help individuals to partner more effectively with their providers, thus improving their healthcare decisions and ultimately outcomes.
Okay, well, another question I have, well, you mentioned managing the whole person. Can you tell us a little bit more about your approach to the whole person?
Yeah, absolutely. We know that social determinants of health determine the vast majority of outcomes in health, right? Things like family care challenges. God knows the pandemic has challenged us all in managing family, work, kids, everything, schooling, right? It's created a lot of financial issues for families. Things like beliefs about care can all impact how that individual seeks or whether they seek care. Mental health is also a key element of that. So one of the things that we have announced recently was mental health integrated care, where in partnership with Ginger, we're taking that collaborative care model in putting a mental health provider into the physician's office, if you will, virtually, in partnering with Ginger to deliver healthcare. We know that oftentimes our mental health networks are lacking and wait times are exorbitant to see a provider. And so what we're able to do is destigmatize that mental health care and to connect individuals nearly instantly at all levels of care. So from coaching through therapists through psychiatry in conjunction with Ginger to really help address those individuals' entire needs.
Great. Well, thank you very much, Corey, for your insights about what Accolade does. And I really want to thank you and tell you how much we appreciate your support for this year's forum. It's great to do.
Thank you.
On this. This will be an interesting session that I'm going to turn over in a second to Nathan Gregory. He is the Assistant Director of Human Resources for City of Plano. Nathan also sits on our board, but before you introduce the session, I just want to mention about why healthcare costs won't decrease in 2021, or will they. That's really, this is going to be an interesting topic. There's lots of predictions that healthcare costs are going to increase maybe 4%. People are, some of the researchers are saying, but the uncertainty due to COVID and the economic changes that have occurred and uncertainty, I just wonder how anyone can predict anything for next year, particularly with delayed care, avoided care, and everything else. So I'm very, very eager to hear from our speakers in this session. So Nathan, it's all yours to introduce the session, and thank you for doing this.
Absolutely. Thank you so much. Appreciate everyone's time this afternoon. And yes, I agree. This is going to be an interesting session. Again, why healthcare costs won't decrease in 2021, or will they? And so I just wanted to introduce our speakers from Accolade and from Milliman. First of all, I wanted to introduce as the Executive Vice President of People and Culture, Britt Provost plays a key role in shaping our employee experience across Accolade and ensuring we attract, develop, retain, and engage our talent. Britt has over 15 years of experience leading people teams in global and growth organizations. Prior to joining Accolade, Britt was Chief HR Officer at Promethean, a global educational technology company serving millions of teachers and classrooms worldwide. Britt also led the people function at Aptio, a software as a service technology business management company. Welcome, Britt. And then Greg Burrell is a physician executive and a product and operations leader. He is currently Senior Director at Accolade. At Accolade, he leads the development of clinical offerings and partnerships in order to improve health outcomes and reduce costs for over 2 million members. Previously, he was co-founder and vice president of clinical product and strategy at Carbon Health, an innovative primary care system integrating in-house advanced technology with coordinated delivery in order to provide a highly efficient, improved quality of care without increasing costs. And then Tammy McAllister is the regional director for Milliman's Health and Group Benefits Practice, working with employers across the central portion of the United States. Tammy represents the very best of Milliman across a broad spectrum of innovative, data-driven, and comprehensive employee benefits, consulting, and actuarial solutions for mid to large employers. Tammy brings over 25 years of industry experience in the employee benefits space. Prior to joining Milliman, she was the director of worksite solutions for a mass mutual firm and spent several years with Aon as an account executive responsible for leading the strategic direction of clients' health and welfare programs. With more than 30 years in the strategic design, administration, and delivery of healthcare and group benefit programs to large private, public, and governmental employer clients, Ron Smith presently serves as Milliman's Regional Director for Health and Group Benefits Consulting Services in the West. In this capacity, Ron is responsible for strategic leadership and oversight of client relationships and overall growth for the practice in the Western United States. Prior to joining Milliman, Ron spent almost equal parts of his career working with large private and public sector employers in both consulting and insurance carrier capacities. So we welcome our speakers for this session. And with that, I'll turn it over to whoever's starting us off.
All right, thank you, Nathan. This is Tammy. We appreciate you inviting us here today. We're very excited. On behalf of both Milliman and Accolade, we want to thank the Texas Business Group on Health, really for including us in this important topic. So first of all, COVID-19 really has reshaped healthcare in numerous ways. And we really want to focus in on a variety of different perspectives. First of all, we're going to talk about the budget and how, it's been difficult to plan for 2020 in addition to 2021. We're also going to lead into the challenges and complexity of the healthcare system as a result of COVID-19. And then Britt's going to dive into the perspective of just what they've done as an employer to manage the unknowns of 2020. And then Ron will, of course, focus in on the strategic insights of the future and where we go from here. So I want to begin with COVID-19's impact on the 2021 budgets. When we look at the numbers, this graph really takes us back to the beginning or the first half of 2020. So in late January, we learned of the outbreak of COVID-19 in China. However, it really wasn't until March in which the United States went into lockdown. It was at that time that we saw a huge drop in elective services being delayed or postponed. We had a slight delay during the summer months. And if we were to extend this graph out for the entire calendar year, we would also see another decrease in services as a result of the second wave hitting, in which we are currently now experiencing. So if we were to include virtual care, we'd actually see an inverse of what is shown here. Obviously, during the periods of March through June, telehealth services were accelerated. The next slide, please. So according to a survey conducted by Kaiser Family Foundation, 48% of individuals surveyed claim to have skipped or postponed non-essential care. This is obviously no surprise to most of us. However, the concerning factor here is that 11% of those individuals, of the 48% who postponed care, really did get worse. So in other words, their situations, their current conditions did not improve in any manner because of the coronavirus outbreak and the need to postpone the care. Again, that's very concerning for most employers. When we think about just elective surgeries and non-essential care being postponed, in the short term, we do see lower costs, but the big question going forward is at what point will these employees and dependents return to receiving the care that they need? Next slide. So we want to share with you a couple of scenarios in which Milliman modeled the financial impact for employers just this past spring. So we will begin with this baseline scenario. We've continued to reevaluate it based on new data, but in this scenario, we assumed that we would not have a second wave of COVID that we are experiencing now, and that we would actually get a vaccine this winter. Unfortunately, based on the information we have now, we know that this didn't actually take place. However, back to this particular scenario, we knew at that point that care was being deferred, and we were expecting the vaccine to obviously bring us back to care. So what you'll see here is the bar chart, the deferral strength resistance from employees or individuals that were resistant to being treated for care as a result of COVID-19. So as we move into 2021, what we're really looking at is the employees returning back to care and really focusing in on at what point will they return to care. What this graph is showing us is that the care in 2020 obviously is reducing our budgets, but the impact will be forced or moved into 2021 as we begin to catch up on services that were delayed and postponed in 2020. The next scenario, we assumed a second wave of COVID hitting in the winter, but the vaccine not being shared or not being available until summer of 2021. Here we're estimating the financial impact in 2021 will be in the range of -5% to +4%. The biggest concern here was around the broad distribution of the vaccine and the availability of the vaccine, which will of course result in continued delays of returning to the healthcare system. So financially, the slow return to the healthcare system is going to have a greater impact or a lesser impact on the employer's healthcare budgets. So in the past 2 weeks, we've heard announcements from Pfizer and biotech stating that they have developed vaccines in which their trials are showing effective rates of 95 and 94.5% respectively. So just today, we heard that the UK granted approval to both manufacturers. However, the US FDA is not expected to really start to review the trials and the results until next week. So the good news is it appears as if a vaccine will be here for the holidays. I guess the main concern with that, though, is just, of course, the distribution of the vaccine in addition to the availability of the vaccine. So I wanted to share with you just this particular slide. It was created by the National Academies of Science and Engineering professionals, and really what they looked at was just a proposed possible model for vaccine distribution. So the group one obviously is going to be the prioritized group. This group really is the individuals that are the healthcare workers and essential industries. When you look at group 2, 3, and 4, the big question around these is just really how quickly will they be able to access the vaccine? And when we're looking at our budgets and returning to care, you know, the concern is focused around at what point will our employees have access to the vaccine, and at what point will they return to care? As a result, we want you to continue to monitor the budgets and obviously look at the utilization within your population on a regular basis. We know that finance is highly concerned about, is the cost going to escalate above, you know, the 4% or 5% that, you know, the consulting firms are using as a model. But we recognize that the ranges are really varying depending upon just, again, the access to the vaccine and, you know, just the need to continue to monitor the availability and the distribution of the vaccine. So I'll turn it over next to Greg, Dr. Greg Burrell, who is going to discuss, you know, a variety of the challenges around that.
Great. Thank you so much, Tammy. It's a really, really great overview of what to think about for 2021 and all of the challenges that all of you are dealing with on a daily basis as we are hearing about ever-changing news and the latest updates on what 2021 may look like. Certainly some exciting news out there about vaccines, but which have been really overall exciting and great news for all of us, I think, but still definitely some significant challenges that exist. And so before I start, wanted to say thank you again to Texas Business Group on Health, to Dallas Fort Worth, and to everyone here for having us. It's been great to be chatting. Would love to be in person, but happy to still have this opportunity and to chat with you all today. And I've really been excited about that. So thank you. And so, and I'll warn you a little bit, mine is, my section here is a little bit of the kind of the bad news. It's a little bit of, what were the cracks that probably already existed that did already exist in the system that this year has kind of exposed and made larger, and then kind of thinking about what can we do about that, and what is the hope that's out there moving forward. And so you can go to the next slide. Thank you. So, I think one point that we certainly learned is for a lot of our routine care, for things that are standardized and have very specific guidelines, things like that, we still rely very heavily on physicians and on physical clinics for a lot of this routine care. And so, you just saw similar looking graphs from Tammy about the number of visits. A lot of those visits were dropped off substantially because the majority of the population had never used a virtual visit before. Even a lot of doctors had never used a virtual visit before. There was a big kind of learning curve very quickly to kind of get adjusted to that and to understand it. The idea of communicating with your healthcare team virtually might have been new for many, many people. And so, really exposed that we rely very heavily on physical spaces and often on MDs, things like, getting tested for COVID, having to have a physician's order early on in the pandemic, things like that. Those created bottlenecks and helped and made people feel like it wasn't safe to go to their visits. So next slide, please. Just thinking about our routine care that's out there, it is difficult to get routine care. And so it's a systemic challenge that 2020 and the pandemic has really brought to light. We don't have enough providers in the United States that are doing primary care, especially in rural areas. And so, I think bringing that to light has really shown in some of those rural areas, although, the light of virtual care is out there that can help with that as well. Currently, we see that nearly a half of folks out there don't see a primary care provider. They go to urgent care, when they have an acute need, or to the ER, and they're not getting the kind of routine care that they need in order to be able to prevent downstream costs. And actually, as we see over the last kind of decade or so, those numbers actually went up. So that the numbers that are not seeing a PCP went up from 38 to 46%. And so, really, I think that light was shown on that for this period, and how they are accessing things that seem to be easier for them, that seem to be an easier option than trying to get a routine visit with a primary care. In addition, we have a pretty reactive model to primary and to chronic care. If we think about things like cancer screenings, about things like kind of care for conditions before they have gotten more significant, things like treatment of prediabetes and prevention of progression to diabetes, things like mental health screening, things like cancer screenings. Those are all not always done, and they're difficult and they're missed quite a bit of the time. And even things like childhood vaccinations, it's often the onus is on the parents, and the onus is it can be difficult to navigate to know when those are due and things like that. And so, I think we've seen some concerning stats this year. Childhood vaccinations are down 40%. And then the primary care visits, as we talked about, we are seeing that cancer screenings are also down quite significantly, and that cancer diagnoses are down this year, although, we don't have any reason to believe that the number of patients with a new cancer is less. So, those will likely, unfortunately, come to light sometime down the road. And so, these are important things that unfortunately will get brought up later. It's hard to know exactly when, but they think that having a really kind of a laser focus on this type of preventive and not just reactive care is really crucial. Just a few more kind of data points around this. I think one of the biggest areas where there is considerable push each year is to get a flu shot in the fall and in the months like October, November right now. But still, that's leaving almost 40%. Oh, sorry, it's leaving almost 60% that don't have it. So certainly still a lot of room for improvement there. And things that are those kind of things that, that we've just grown accustomed to, that in the doctor's visit, you get, a few seconds on, hey, make sure to exercise. Hey, make sure to eat healthy. Okay, we'll see you in a few months, and that's it. And so, we really kind of need to think about how we tend to some of those things. Oh, and how are your moods doing? You doing okay? And that's a tough time to say, well, maybe I'm not doing so great. Maybe I am having some stress and things like that. It needs to be more of a forum where you feel like, it's not a rushed visit. You feel like you have the opportunity to talk through some of these things before they progress to something worse. So certainly these are areas where we feel like there's a lot of room for improvement. Oh, and speaking of that, the one area, that I think that I'm sure many of you have felt this in one capacity or another, either in the position where you are as employers, or with family members or friends, or even with yourself. But certainly mental health can be a challenge in the United States. Feel like access is a challenge. Getting to reliable care is a challenge. The cost of care, can be challenging. Anybody who's kind of in network is a long wait. Anybody who's out of network is going to, break the budget. And so, quite a bit of challenge. And of course, that we really think of kind of like the second hit of the pandemic as being a significant mental health burden, unfortunately. So, very, very, very high numbers of stress in the workplace about personal health, about financial health, about just kind of employment safety. That's gone up dramatically. Many people saying that this has been a very stressful time. Folks like new mothers, pregnant women, also feeling a lot of stress around this time. And so, these are areas where we really have opportunities to focus in with much more diligence on mental health. And speaking of that, I think one of the ways that this plays out in the cost equation certainly is that particularly for folks with a mental health condition that are also struggling with one or more chronic physical health conditions, things like having diabetes and depression, about having conditions, managing a chronic physical condition and a mental health condition. Certainly, those two unfortunately play off each other and need to kind of both be managed to be able to help get things under control. That often results in increased ER visits, increased inpatient stays, and so significant direct medical costs. And then of course, huge numbers around the indirect costs of productivity, absenteeism, and even attrition from employment. And then lastly, and then I promise we're going to move on to some good news. Is we've seen that that the healthcare at times in this country, or the healthcare can be unfortunately very inequitable, and so we see that this pandemic, although I think that it unfortunately mimics other healthcare as well. It's not just COVID-19, but other healthcare as well and other healthcare outcomes. They do have an inequitable and unequal effect on certain populations of people, on African Americans and Latinos, and so we do need to think, to kind of continuously focus on and think through ways that we can address and try to even those inequities within the system. So so kind of thinking about taking some of those negatives and turning them to positives. The areas that I'll pass off to Britt in just a moment, but the areas that we think that are really going to be significant focus areas to help with those 2021 scenario that Tammy presented is helping folks with returning to work, getting people to the right type of care that they need at the right time. Those social needs that we talked about to really be able to help with mental health, with care that is oftentimes can be inequitable, and so helping to balance that out, and then really thinking about the whole person, and not just like you're somebody with diabetes, but thinking about the whole person. So Britt, I know that you are in a great position here, having to think about all of this and making a lot of tough decisions. And so, we're excited to hear your insight. So I'll pass it off to you.
Thank you so much, Greg. So I think for all of you that are in the room, and I'm excited to be with you, can we go back to the previous slide? We're skipping ahead a few. Can we go back to the one with the gal with the red jacket? Awesome. Thank you. This has been a wild and weird year, and I will confess to all of you, I actually started my job with Accolade in January of 2020. So not only have I kind of come into an organization to understand where we are and to understand the focus that we have, you've obviously heard a little bit about what we do. We have a lot of folks that are on the front lines talking to people that are going through this in this moment. So we're managing multiple things. We're managing, an employee base that's also got a little bit of compassion fatigue because they're supporting people that are going through this wild and weird year. And again, for me as a HR leader and professional, I'm trying to figure things out on the fly. If you had told me that I would become an expert in COVID and working through some of the racial injustice conversations that we're having in this country right now, at the same time we've got everybody working from home, I probably would not have believed you in terms of all the different things we've had to do to adapt and be focused on taking care of our folks in the moment. So 2020 for me has really been about, being swift, being smart, doing interventions, being flexible with our employees, and figuring out what we need to do. And I'm sure for a lot of you, you weren't just waiting around for open enrollment to make changes to what you needed to do with the benefits. It felt early on like there was something coming out every week on the CARES Act and what that would mean for employees. We feel like we're having a little bit of a moment to breathe, but we're headed back in. You've heard, we've got vaccines. What does that mean for us in the workplace? When do we get back if we actually are going back? Who wants to go back into the office? I probably have half and half in terms of folks that want to get back to the office and folks that would like to stay remote. So as we head into this next year for 2021, I got to balance out all of those things with how much money is in my budget to spend. And making sure that I'm really taking care of employees, they're whole humans, and actually all the humans that are living in their houses that we now see on screen, whether or not that's kids because school's out, older parents, a variety of different things that we've just had to deal with. So 2021 for me is really going to be about making sure people stay healthy, and that we're also pretty thoughtful about managing cost. We go to the next slide, I can dig in a little bit deeper on some of the things we've done. And I'm not going to get to everything here, but certainly for me as a resource, if you want to reach out on LinkedIn and whatever else, I can send you some of these things. I really don't want us to, as HR leaders and benefits leaders in particular, to have to recreate the wheel. I'll say overall, 2020, we really looked at a flat open enrollment. We did some really focused interventions in both May and September that I think really helped us get ahead of that. Not inconsistent with how we opened up in this conversation, the increase that we passed on overall to our employees was about 4%. So we are a pretty good bellwether for a lot of the things that Tammy was talking about, that Greg was talking about, and Ron's going to talk about. So we added a behavioral mental health resource. We did a lot to make sure we couldn't actually do COVID testing, but we could at least do resources to get people to COVID testing. And so we've been actively monitoring to see how people have been out, what the impact has been in terms of, what is that short-term disability, or what does that mean? And early on, we took a really focused approach on getting co-pays and other costs out of the way for telehealth. And we really feel like incenting that was the right thing to do. And again, given the work we do with the customers and members that we support, we were in a really good position to hear what other companies were doing and get ahead of it. In September, we took a bigger approach that was focused on caregivers. A lot of what that really looks like in practice is adapted schedules and being thoughtful about whether or not we can give people leave opportunities or different schedules. We didn't want people dropping out of the workforce. What we are still seeing and what we don't have an answer to, and that is a cost issue that I encourage you to look into in your plans, is what's happening for special needs kids. There are a lot of caps that are in place for these situations, and we've run up against those caps already. November we were starting to hit those because schools weren't in practice or weren't in session, and so we were having to find different ways to take care of kids and figure out how to take care of our employees and the costs in there. So I encourage you to dig into that. I think that's still an open issue for us as we continue. We'll turn into the new calendar year. We'll have a different kind of cap schedule. But that is something we're going to have to continue to watch until we get back to a regular place where schools are in session. We did some additional things with PTO carryover extensions. We really looked at what states do. They do different things, but we wanted to make sure that we gave some extra padding around the edges. We've seen tech companies, I'm based in Seattle, we've seen tech companies do big amounts of time off, and we've seen other groups do sort of small amounts, and we tried to figure out how to be in between and rational about what we were going to do. This is not to say we're not going to probably look at it again in terms of 2021, just to make sure that we're doing the right thing. We've encouraged people to take time off, but in this moment, it's been really hard, and especially with the additional caregiver responsibilities, we're trying to be flexible in terms of where people are. A lot of what I think we did early on that was really smart was figure out how we were going to get the information out. So we have COVID-19 and a well-being communications channel. We've updated kind of what we do for our people leaders as well. And we're trying to do regular campaigns to make sure to connect with folks. We've done a huge push to make sure people are getting their flu shots. I think we're at about 50% of people adapting and taking advantage of that. We're still watching that. We're continuing to adapt in terms of what testing access looks like. And to be candid, we're starting to continue to hear from folks that are coming down with COVID. What I'm seeing this fall is people taking more time away. More so early in the pandemic, we were seeing people, worried because they were exposed. Now I've got more people that are actually being diagnosed with COVID. So what does that mean for long-term costs? What does that mean for short-term disability, leave of absence, FMLA, et cetera? If I had one piece of major advice for you all, your people managers are on the front lines of all of this. And so we've tried really hard not to overwhelm them and have too many expectations, but to figure out how we can support and provide resources for them as well, because they've been really our early detection system in what's going on, how are people doing, et cetera, et cetera. The mental health impact of this year on absenteeism, call outs, whatever you want to call it in our business and probably your business as well, is no joke. And so we are continuing to kind of look at that and see where we are. Let's go to the next slide. So kind of what I talked about in a lot of ways, we wanted to be super comprehensive. We wanted to make sure to take care of everyone equally. There was a lot of discussion we had about what do we do for caregivers that's fair for other folks? Do we have to make a determination on folks with elementary school kids versus folks with high school kids? And how does that all look? Because, you really want to make sure you're taking care of everybody. And this idea of healthy is bigger and broader than just getting people to preventative care. You heard Greg talk about how people aren't doing that right now. it's also preventative care on the mental health side. So you got to make sure what you're doing is inclusive and comprehensive in this moment. I think you also have to make sure it's proactive. You want to keep getting to people. You get to them early, you make sure that it's personalized depending on their particular situation, and they're making the best decisions. Again, this is where the PTO, the floating holidays, the time off, we want people taking care of themselves. And if they need to take time off because they're not well or they're taking care of somebody in their household, we want to make sure that we've got those situations as well. The last thing I would just say, you know, we've got a lot of conversation that happens now about the whole person. We're seeing whole people come out on these screens when we have these meetings. We've got pets coming into play. We've got other folks coming in. So we just really want to make sure we have context. And so we're really trying hard as an employer to make sure we have context on what's happening individually with our folks. One of the best things we did early on was launch our well-being channel and have conversations about that. We've also been assessing how we ask questions in our regular kind of, we call it vitals, which is our regular check-in with employees to get their feedback. And we're really trying to understand how they feel about us as a senior leadership team in terms of the way we support their well-being, and also how their individual people leader does that. Those two benchmarks have been really, really important for us so that we can kind of adapt, and also we can continue to get information to those two populations when they're in front of our employees to make sure people feel like they're taken care of. So those are some of our, you know, guiding principles in terms of how we were thinking about the design of the work. We go to the next slide. Return to work is still a really open issue. We actually had a town hall this morning for our employees, and everybody's got a different situation depending on what you do, depending on who your customers are, how you're thinking about things. Right now, we're in a holding pattern, and so we're keeping people out of the office. That includes everybody that's on the phones with our customers and our members. We've also got folks in the Czech Republic, and they are starting to go back into the office, although they've been out as well. So we've been trying to think a lot about how do we get information out? What resources do we provide? We're going straight to the state detail. And like I mentioned, we have the well-being channel, which has been really successful, but also the COVID channel. So we use that channel to talk a lot to our employees about what they should expect in terms of return to work, what that means. And then we also, I know from an Accolade perspective, we've been helping a lot of employers think about what they need to do in terms of getting their employees to testing, making sure something, you know, is in place if something happens so that people can be taken care of. We're using all the same rules in terms of the way that we operate day to day. And again, that incenting telemedicine spend has not raised our cost significantly, but it's been really, really important in terms of, I think, access for our employees overall to make sure they're getting taken care of. We go to the next slide. Greg talked about this a little bit, but, you know, again, getting people to the right care. We've just, again, being really super thoughtful about making sure we're doing outreach. We knew who we're talking to. We've got guides. Not only do we have these channels that sort of exist on Slack, but we also have a whole COVID-19 channel where we talk about all of the different things that are available and being really specific about what else we're offering at this time. We have pushed two programs, our mental health program through Ginger and our financial wellness program through Brightside, very intensively during this time, because we feel like both of them are really good resiliency supportive opportunities for our employees. And we've made them available not only to our employees, but people that live with them. So, you know, folks that may be on insurance, but we've also extended that in some cases for folks that are at home. So dependents and others in the family home. We've really leaned into telemedicine, and I think it's really paid off. And again, from a costing perspective, we're not seeing, you know, huge changes in that, and we're actually going to continue to sustain the waiving of copays and the real push to telemedicine throughout 2021. I think to my last slide, these are some of my key takeaways. I've mentioned a bunch of these things as we've gone through. I think we're all ever learning and kind of focused on what we do to get to our employees and our teams and their families at home. But we do use dedicated channels to make sure we're getting the message out. When we don't actively use the COVID channel and the well-being channel, we hear about it. People are expecting us to continue to communicate and keep them posted on what's going on. I say communicate and then communicate again. You need to get in front of these frequently asked questions and policy changes. Before we do town halls, we do a survey to see what people are going to ask us. And in some cases, we proactively feed to those channels so that we can get in front of those questions and focus in that time in a different way. As I've mentioned throughout, we are really pushing hard to give people time and space to get to their preventative care. And we are really highly incenting telehealth. And that includes the mental health component as well. We're engaging the whole family and the whole human, and we want to make sure that we're really aware of what's going on with the challenges with kids being out of school and what that means for caregivers and how we can proactively address absenteeism if we adjust schedules. Throughout this whole time, through May and ongoing, this open dialogue with mental health has been so important. And all of this is supported and sustained by mobilizing our people leaders. We need to take care of them. They're tired. But a peer coaching tool might be something you also consider. We've implemented some of that as well. And having managers talk to managers has been incredibly valuable in terms of keeping them connected and not just transmitting a bunch of information to them, but having the opportunity where they can share a little bit of the stress and a little bit of what's going on in the world that they're trying to get through right now. With that, I believe the next slide is transitioning over to Ron. Ron, take it from here.
Indeed it is. Thank you, Britt. Really appreciated hearing the Accolade perspective on this as an employer. I think we get very accustomed to hearing from Accolade and others in the marketplace as providers of service to other employers. And so it's very compelling when I hear an employer who is also a provider of service to other employers hear you talk about what you're doing for your populations. It's really compelling. So thank you so much for that, Britt. I promised to pivot to looking at the future, but I'm actually going to start with a bit of a zoom out, if you will. Can we move on to the next slide, please? So August of 2019 seems like a lifetime ago for all of us, right? But that is when the National Business Group on Health published a survey that they conducted in the May and June timeframe of 147 large employers representing almost 16 million lives. I'm not going to cover all of these insights, but you heard Greg and Britt refer to a number of these throughout the course of their comments. Number two, social determinants of health on the radar for employers. Absolutely was on the radar in 2019, and even in a more profound way now in the age of COVID, where we're focused on inequities, both social inequities and healthcare inequities in new ways. Number four, the expansion of virtual solutions. You heard both Greg and Britt talk about their commitment to expanding virtual care. And virtual care has moved beyond being just a convenient service and really has turned into an avenue for virtual primary care and other services. Nowhere on this list do we see an impact of the global pandemic. And you heard Britt speak to that and what a blindside this was for employers. The observations that I make based on this list of insights for 2020 is that much of this didn't happen. Number three, that's partially been answered in the lead up to the election that we just had. The second half of that is yet to be seen. But by and large, we all hit a giant pause button in terms of the strategic initiatives that employers were looking at for 2020. I will say, however, that all of these remain relevant as we look to 2021 and beyond. And as I continue my comments here, I'm going to start to pull these back through as a thread as you're looking at both your budgets and your strategic initiatives going forward. Next slide, please. So I'm gonna camp here for just a few minutes. So what did happen in 2020? And you did hear Greg and Britt talk about this quite a bit. COVID literally hijacked everything for all of us. How and where we work, how and where we gather. I would much rather be sitting with you in some ballroom in Texas rather than inviting you into leaving money on the table. The pricing in the pharmacy space and the pricing in the pharmacy space and the provisions and contracts change rapidly. And so there is an opportunity for you to refine and improve these through audits and other activities. And there's a tangential risk here that I want to talk about briefly, and that's around the notion of stop loss. And I really have two questions to pose to all of you. The first is whether or not you purchase stop loss. And the second is when is the last time you had a risk tolerance conversation with your CFO or finance? If you don't purchase stop loss and you haven't had a conversation with your CFO or finance, that conversation may be long overdue. I have unfortunately been party to some very uncomfortable conversations when one of these mega $9-10 million claims crosses the finance desk to be paid. And the CFO and the CEO want to understand why they're being asked to fund a claim of that magnitude and what could have been done or what could be done to prevent it. So this is just a cautionary tale of just avoiding surprises with your finance folks. There are high deductible products out in the market today that you can take a look at if you determine that stop loss is appropriate for you, and just ensure that you're aligned with finance. As an aside, given what's happening with specialty medications and gene therapies, we are starting to see some changes in the stop loss market. There's already one carrier that has positioned a pooled product around some gene therapies, and I expect that trend to continue as we move forward. Next slide, please. I'm going to move really quickly here. I know we only have about 5 minutes left or so. On the employee engagement front, the National Business Group on Health Insights indicated that employers are simplifying the member experience. And this graphic may run completely counter to that argument. If you look on the left-hand side, this doesn't do justice, quite frankly, to the vendor landscape that is out there from a point solution standpoint. There absolutely is a place for these vendors in your strategic initiatives, dependent on the underlying conditions and what you're trying to solve for in your population. The landscape is overwhelming, no question about it. But flexibility and integration are key. If you look on the right-hand side of this graphic, these vendors address some very critically important conditions in your population or access to providers in very critical areas, such things as chronic care management, targeted conditions around things like diabetes, cancer, emotional well-being. We've talked about the importance of behavioral health and financial well-being as well. The traditional carriers have come a long way in terms of digital assets and innovation, but some are better than others in terms of their willingness or ability to integrate some of these point solutions into your programs in an integrated way. So again, 2021 is an ideal opportunity in a transition year to consider and discuss with your existing partners the flexibility you have in your contracts, and even better yet, what costs might be associated with including some of these vendors in the future. Finally, in this context, let data be the guide in terms of how you construct this in a way that is integrated to the employee experience. Next slide, please. The last thing I'm going to touch on, and literally we could spend an entire hour talking about optimizing provider networks. The National Business Group on Health, again, some of the insights, implementing advanced primary care strategies was identified as an emerging trend. In the interest of time, I'm going to move very quickly through this. I like this graphic. This really breaks this down into 3 primary strategies around increasing access points, steerage, and restricting access to varying types of providers across the continuum of member disruption. So at the lowest end of member disruption, things like direct primary care where you're paying a membership fee for access to primary care, the expansion or introduction of telehealth visits to include virtual primary care, on-site and near-site clinics. From a steerage standpoint, looking at tiered networks, so taking an existing network construct and tiering it to steer members through benefit design to more cost-effective, high-quality providers. Reference-based pricing, where you're setting a reference price for certain services like knee and hips, and potentially eliminating out-of-network coverage altogether. This probably would not have been a strategy 5 years ago that we would have talked about. And I've quite frankly been surprised by some of the large employers, some of the largest employers, quite frankly, who have eliminated out-of-network coverage and have seen significant financial savings. And then on the restrict access side, true high-performing networks where you are steering members to those highest quality, lowest cost providers, centers of excellence where you're actually having people travel to specified providers for certain services, and direct contracting. Next slide, please. I'm gonna finish, and again, very quickly, as we shift from a reactive stance to a more strategic and proactive stance moving forward, to encourage everyone to have a frame of reference for the development and execution of your strategy. You heard how Accolade has survived 2020 with all of the initiatives that Britt has introduced for their population. I would expect a conversation that I would have with any other employer would have some consistent themes, but the actual approach might be somewhat different. From a strategic standpoint, I would expect the same thing. I would expect every employer strategy to be unique to them. This is about you, not about anything else, and it has to be a cultural fit. So as you look to a construct, look to your partners, your existing partners and advisors to leverage data, to understand your key areas of cost, clinical opportunity and need, optimize your plan performance by fine-tuning the fundamentals. And that gets back to looking at the contractual language as I referenced earlier, exploring alternative network and clinical models, assist in the strategic execution to ensure that it's aligned to your culture, and takes advantage of and embraces the rapid pace of change in this market. And of course, look for opportunities to personalize that member experience. Last slide, please. So we've covered a lot of ground very quickly. We established a very ambitious agenda and did in fact cover a lot of ground. There is no doubt that COVID has had a profound impact on all of us. Deferred care has impacted our budgets in 2020 and will continue to do so in 2021 and beyond. I don't have a crystal ball. I don't know that we necessarily answered the question about whether healthcare costs will increase or decrease in 2021. I think there's a range of expectation on what happens. The vaccine timeline, the vaccine cost, the employer response to those, all will have an impact on the cost that we see in 2021 and beyond. But have no doubt that costs will in fact rise again in the future. And so it is important as we pivot from 2020 to 2021 and beyond to focus strategically again on those initiatives that are going to help you control your budgets going forward. And as I said earlier, the key messages I really want to leave you all with today, you survived or are surviving 2020. We're getting through this together. Your efforts are appreciated. 2021 is likely to be a transition year, and I think we need to have the permission to acknowledge that and position our programs for success in the future, and to not allow COVID to paralyze us or to distract us from our strategies going forward. With that, I want to thank the Texas Business Group on Health and the DFW Business Group on Health for having us today, and would like to return this back to our moderator.
Okay, well, thank you so much for just a very comprehensive presentation by all of you. I just was totally impressed with all the data that you presented, Tammy, and then you, Dr. Burrell. I made, jotted down copious notes about all of that, and I should have just waited for the slides, which of course we will send everyone who's participating a link to the slides. Britt, your description of what you are doing for the employees, Accolade employees, is just totally impressive. And Ron, you're being kind of the last on the list, describing the real strategic approach. I felt like your last few slides were probably the most succinctly closing everything together that you were just describing. Just very, very well done. Thank you, all four of you, for being part of this. This discussion, and like I said, I can't wait to see receive the actual presentation. This is going to be good reference material.